Eric Arzubi. I'm CEO of Frontier Psychiatry and a child psychiatrist. And I have here Dr. Swati Krishna, who is our medical director of child psychiatry. Swati, thanks for joining us.
Absolutely.
I know you and I are starting to get some
Mm.
questions from parents because that's, only a few weeks before kids are back in school. So one of the issues is kids have a summer sleep schedule, and then at some point they have to transition to a sleep schedule for school, which is a lot of times very different. So tell us a little bit about what your thoughts are on how to help families and kids transition to a more reasonable sleep schedule that is better for school.
Well, and I think it's first of all, I think it's really important to know that all kids go through changes in their sleep schedule, right? So
Yeah.
having a different schedule for summertime is absolutely normal. Having a different schedule when you really need kids to get up and go to school and have a more structured environment is normal.
It's not a bad thing that these things are
No.
happening. Yeah.
And it's also, it's also good to like kind of think about what environment that you're kind of needing at that time, right? So I think during a school year, probably you need a little bit more routine during a summertime where you don't have to necessarily be awake and asleep and have the type of demands on mental functioning that school might give some kids,
Right.
then that's a very different environment, right?
Now makes sense. Now, if I remember correctly, kids of different ages have different sort of sleep requirements, right?
Yep, and I wanted to do my research on this, so I pulled these numbers directly from the Academy of Child and Adolescent Psychiatry. So these are the general recognized amount of sleep per age group. So infants up to 12 months, you want about 12 to 16 hours of sleep. Children 1 to 2 years are about 11 to 14 hours of sleep.
Uh-huh.
Children 3 to 5 years, 10 to 13, 6 to 12, 9 to 12. And then as your kids become teenagers, 13 and up, it's usually 8 or whatever they may need for themselves. Some kids, and these are just general parameters, right? Some kids need a little bit more sleep and a little bit less sleep. I think the one thing that we tend to worry about is if very young children are not getting the minimum required sleep,
Right.
is that then we tend to see more problems as kids grow up and their brains mature. They probably need less and less sleep. And so if they aren't making their generalized requirements every night, that tends to be a little bit more okay.
Makes sense. Now, I know as adults, we know that when we don't sleep enough, it affects us. How does it affect kids? I think we all have seen our kids affected in different ways, but what are the things that you look out for if kids aren't sleeping well or sleeping enough?
Well, and I think a lot of parents notice this themselves that if their kids have a bad night's sleep, they don't necessarily have the best day the next day. So if you
Right.
think of that as a pattern, regular sleep deprivation in kids can show up as just difficult concentrating, difficulty focusing the next day, being irritable, being moody, not being able to transition well into the from morning routine to trying to getting ready for school. And like on a more medical front, then it can lead to high blood pressure in kids, obesity in kids. And we know that over time, less sleep can cause, less of an immune response. So kids can
Hmm.
get sick faster. And then it also can help affect their mental health. If they're just tired all the time, they don't have the mental energy to deal with their day. You can
Yeah.
imagine, even as an adult, we would feel irritable, being tired all the time. So kids, of course, feel it even more.
Yeah. No, and I know that if I don't get enough sleep, I know my anxiety goes through the roof. So I need my sleep for sure. So what are the most common signs of sleep problems in kids? Like what are things that parents should be looking out for?
So, pretty much kind of generalized problems falling asleep or staying asleep during the night, feeling really tired during the day, and having nightmares. Some kids even have some bedwetting problems, which can be medical or, can be due to like kind of these poor sleep function, teeth grinding, snoring, sleepwalking, moving around way too much in the sleep, and then sleeping during the day and staying awake at night, which we see a lot
Yep.
now in our transition from summertime over, is that we're not paying attention sometimes to especially some of our older kids, what they're kind of doing late at night. And
Yep.
then they kind of sleep in, but then transitioning back. It's
Yeah. And it's so hard, right? And I know that this has probably been said over and over again, but the access to video games and screens and so forth, if people just stay up and it's such a hard thing to fight.
I know it takes some diligence, but also if we think about sleep health in general, it also affects the family, right? Kids aren't sleeping well. Sometimes parents aren't sleeping well with really young kids because they're keeping their parents up. Or the morning time gets very frustrating, or the next day people are
Yeah.
very frustrated. So it also affects just the family pattern as well. And so everybody gets affected.
Yeah, it makes total sense. And I think sometimes we don't appreciate that as much as it does happen. And so how common like are sleep problems in kids?
So probably from 4 to 12, it's about 30%, we think. It drops a little bit after they become teenagers, about 24%. But again, we're talking about these are sleep patterns that are consistent over time, not just a small transitional period. One or
Right.
two that's pretty normal, like, trying to when you're trying to change things up, but this is, like, a consistent sleep pattern. Things aren't going well for more than probably 2 weeks at a time, and it occurs in about a third of kids, so it's pretty common. Also occurs more when kids have things like ADHD or anxiety or depression or just kind of general mood irritability. So that also kind of, keeps them from sleeping very well at night, right?
Yeah. And I mean, it's amazing how many mental health problems actually affect sleep. I guess both ways, right? So when you sleep poorly, it affects mental health. And when you have a mental health problem, it affects sleep. I mean, it's really it can be a vicious cycle.
Yep, exactly. So we've got some tips
Yeah. So what do you
on,
recommend?
first of all, kind of, I think it's really important for parents to understand that if things change all of a sudden, look at what might be causing that change, right? Is it a new bedtime routine, new kids at school, new teachers at school, kind of looking at the environment, seeing what is going on. Is that something that we can just address?
So like the way you're
Yeah.
saying, like, right, because of kids function in a couple different systems. So what's happening to the family system? What's happening to the school system?
Yeah.
Kind of in these pockets of functioning for these kids, right?
Yeah. So if like something all of a sudden changed, your kids were sleeping great, and then now they're having a little bit more trouble, even just talking to them about what has changed, looking at kind of the grand scheme of the environment and saying, like, are there some things there that might be affecting their ability to fall asleep as well?
Makes sense.
And then any changes in daily, nightly routines. And so I think one of the biggest behavioral interventions, as we will, and the first thing to try, if you've noticed that this is a new thing, kid isn't sleeping well for more than 2 weeks, or this has been an ongoing thing and you're really trying to institute some changes, getting a really good nighttime environment and structure is very important. The physical environment should be a cool, dark room, right? No screens or electronics in the room, hopefully, if possible, during sleep time, but we say also cut it out for about an hour before you want the kid to go to sleep. That's
Right.
also good for adults too. It's very difficult to keep that intervention in place, but we try. And for really young kids, getting them onto a nightly routine that's calming, not just telling a story, talking about your day. And this can be very quick. Parents don't need to spend 30, 40 minutes in the room. This can be a 10-minute calming environment, but then in bed, so the kid understands, like, okay, it's time to get in bed. Now I'm going to have my story time. Now this is my brain's cue to trigger myself into my nighttime routine, which hopefully is inducing sleep, right? And it's really helpful when trying to change the sleep patterns to be consistent, not to waver by more than 1 hour of waking or sleeping for at least a period of 2 to 3 weeks. So that kind of resets the internal clock.
No, that makes sense. And I think you and I were talking about this before. You and I are both parents, and it can be hard even for child psychiatrists to
Yep.
implement these things. We definitely recognize it's a challenge. The other great point you brought up is the fact that behavioral interventions are tend to be the most effective, and medications are really down the line in terms of using them. I mean, what are your thoughts? At what point do parents start thinking about something like melatonin?
I think we've got a couple different stages, right? Some kids that have naturally not been great sleepers from early childhood tend to maybe benefit from medications earlier. Because again, we know from a lot of studies is that intervening earlier and kind of getting kids on a really good sleep pattern at a younger age is really helpful because that establishes a pattern, which is harder to establish maybe as kids get much older. And so, maybe utilizing medications, melatonin is available over the counter, very easy to use. Some kids I don't know about you, but in my experience, some kids respond really well to it. Some
Yep.
kids don't.
Yep.
And so it's not that might not trigger their endogenous sleep system as well as other kids. So then there are further steps,
Yep.
especially I think the biggest thing that I tell parents is if it's affecting a kid's daily life, it's affecting their school performance, it's affecting their joy of school or joy during their day, making them irritable, affecting the family life. Again, if it's really affecting their environment and they aren't able to be successful in their day to day environment, it's going to affect their mood and anxiety over time. So that's kind of when I think for help,
Yep.
behavioral interventions are great. Still, that can be the primary intervention, but in case medications are needed, it doesn't also have to be for forever, right?
Right.
Like a lot of
Exactly.
times we can use like a temporary couple of weeks, let's get the structure back on track, everyone work together. And then that in itself will kind of lead to more beneficial outcomes over time, right?
Sounds great.
Kids will feel
Well,
better, parents feel better, everybody
right.
feels better.
No, 100%. No, but no, appreciate this conversation. So again, just kind of quick summary, really. And tell me if I'm missing anything, but big picture, right? So sleep problems are very common. They can be either kind of short lived because of some immediate transitions, or they can be longer term. But you kind of think about those differently, and the different severity of issues, right? If it's a couple nights and it's not really affecting day to day living, great, probably minimal intervention. But if it's a pattern that's been established early on, then you probably tend to worry more. And certainly it affects both physical and mental health
Yeah.
if there's sleep problems.
And
But
not all kids are the same. We know that,
exactly.
right? So if your kid is sleeping fine and you're not doing much of these things, no problem. But if there are changes or you notice that your kid is being affected by these things, then these are some of the things that you can try to implement to get them back on track. And all kids go off the track
Yep.
every once in a while.